If you've been diagnosed with lumbar instability, it can be a really confusing and honestly a frustrating experience. So the whole goal here is to cut through that noise and bring some real clarity to the full range of treatments we have available today. Let's start with the single most important idea.
Okay, so picture this. Two people can walk into my office with MRI reports that look almost identical, but they might walk out with completely different treatment plans. Why? Well, think about a 45-year-old runner who's determined to get back to running marathons. Their goals are worlds away from a 68-year-old who just wants to walk through the grocery store without pain. It's not about the picture on the MRI. It's always about the person.
And that really gets to the heart of our philosophy here at Vertrae. The treatment has to follow the patient, your goals, your lifestyle, your unique biology, not just some label you get from a diagnosis. Spine care is just not a one-size-fits-all deal. We're building a plan around you.
So, to make sense of all this, we're going to walk through the entire treatment spectrum, step by step. We'll start with the foundation that applies to everyone. Then, we'll look at some amazing restorative technologies, talk about the true role of injections, and then get into when surgery becomes the right conversation. We'll map out how these decisions get made, and then bring it all back to you.
Every single person's journey with lumbar instability, no matter what, starts right here. This is what I call the universal foundation, a very, very specific type of physical therapy.
Now, that term, stability-directed, is so important. This is not about just doing a bunch of crunches or general core work. No, we are targeting the deep, almost subconscious muscles, like the multifidus and the transversus abdominis. See, these muscles are supposed to fire automatically, like an autopilot system for your spine. With chronic instability, that system just shuts down, and our first job is to get it switched back on.
So the goal isn't just about getting stronger. It's really about re-education. We're waking up that automatic function in those deep muscles. We're retraining your brain to move in smarter ways that protect the unstable area. And we're restoring your spine's own internal GPS. It's called proprioception. Its ability to know where it is in space, which is something that often gets lost.
But what happens when you've done the work, but that mind-muscle connection just can't be rebuilt with voluntary exercise alone? Well, that brings us to our next layer of treatment, which is all about actively restoring functions that have gone offline. One of the most incredible options here is a technology called Reactivate. This is a small, implantable system that's designed to directly rehabilitate that key multifidus muscle. Twice a day, it creates these little contractions that essentially act as a physical therapy session for those deep muscles, retraining and strengthening them from the inside out. And this is so key. This is not about masking pain. It's active muscle restoration.
So who's a good fit for this? Well, it's for a very specific person. Someone with that chronic mechanical low back pain who has not had surgery on their low back before, who's given good conservative care, like PT, a real shot, and who doesn't have a big structural problem that points directly to surgery. It really fills a critical gap.
Now, another really targeted treatment is basivertebral nerve ablation, or BVNA. This one goes after a specific kind of pain called vertebrogenic pain, which basically means pain coming from the bone itself, right where the disc meets the vertebra. If your MRI shows something called modic changes, that's a huge clue that this might be your main pain generator. BVNA uses radiofrequency to quiet down the nerve that's sending out those pain signals.
The perfect candidate for BVNA is someone whose pain story really lines up with those modic changes we see on their MRI. They've tried conservative care, but they don't have a major instability that would require a fusion. Again, you can see it's a very precise tool for a very precise problem.
Okay, let's talk about things like epidural steroid injections or facet blocks. It is absolutely crucial to understand their real purpose. They are here to support the real work of getting stable.
Let me be crystal clear. An injection does not fix instability. It can't. What it can do, and what it's great for, is managing a really bad pain flare-up. It can turn the volume down on your pain just enough so you can actually show up and participate in your physical therapy. That's where the long-term change happens. They can also be fantastic diagnostic tools to help us pinpoint exactly where your pain is coming from.
But sometimes, after we've exhausted all the conservative options, we have to face the fact that a structural problem, well, it needs a structural solution. And this is when we thoughtfully begin to talk about surgical stabilization.
Now, the modern way we do this is called MIS TLIF. This is not your grandfather's old-school open fusion. We use tiny incisions and techniques that spare the muscles to get in, eliminate that abnormal movement, and restore the spine's alignment. The end goal is the same, a solid fusion, but we get there with so much less trauma to your body, and that means a much, much faster recovery.
And how do we do this? We lean on technology that gives us a level of precision that's just mind-blowing. At Vertrae, we use the Mazor robotic guidance system, and that allows us to place every screw and rod with sub-millimeter accuracy. Think about that for a second. This isn't just a fancy gadget, it's a completely new standard of safety.
So what does this actually mean for you, the patient? Well, that sub-millimeter accuracy massively reduces the risk of anything being misplaced. We can create a perfect 3D plan of your surgery before we even make an incision, which cuts down on surprises. And the system gives us real-time navigation during the procedure. It all adds up to a safer, more predictable, and just a better surgery for you.
Okay, so we've covered all the individual pieces, but how do we actually put it all together? How do we navigate from one of these options to the next?
Let's walk through a very common pathway. So, you get a new diagnosis. Step 1 for everybody, stability-directed PT. Let's say that doesn't get you where you need to be. But there's no obvious reason for surgery. That's when we evaluate you for targeted options, like Reactivate or BVNA. Now, what if your pain is so bad you can't even do the therapy? We might use an injection as a bridge to get you there. And finally, if there's a significant structural issue, like a vertebra that has slipped forward, that's called spondylolisthesis, and nothing else has worked, that's when we start the surgical evaluation for a procedure like an MIS TLIF. See? It's a logical, step-by-step process.
And this brings us right back to the most important part of this whole discussion. After you understand all the options, it all comes down to you, your path, and your decision.
I really want to end with this, because it's something I feel so strongly about. Spine care is not a protocol that you just follow blindly down a checklist. It is a conversation. It's a partnership where your goals, your life, and your priorities are just as critical as anything I can see on an MRI scan. My job is to make sure you get it, you understand every single option, and then together, we choose the path that's right for you.
So I'll leave you with this question to think about. Based on everything we've talked about, your goals, what you want your life to look like, your symptoms, what does your personal path to stability look like?
If you're ready to start having that conversation and happen to be in the Dayton, Ohio area, I genuinely invite you to reach out. At Vertrae, we can explore this full spectrum together and build that personalized plan that is just for you. You can learn more at vertrae.com. Thank you so much for your time.